I told you a story about Ward 6 last week. If you haven't heard that story yet, I want you to stop this video and go watch that one first because it's our most important story this year and also because this video contains spoilers about that story. Well, it turns out Dr. Punderly might be more than just the director of risk at Glencroft Psychiatric. He might actually be the owner of Glencroft Psychiatric. His name is listed on Glencroft's property tax documents. But don't worry, he's careful not to associate himself publicly with the hospital. After all, Dr. Pendleton doesn't use email. Not until now. Sources tell us there is a hidden folder inside Glencroft. 5. After Amanda Clark died, her grieving colleagues found comfort in one another. That is until they were served with subpoenas demanding they hand over their phones and laptops. He cornered her in a supply closet and forcibly touched her. The hospital's own description calls it, quote, a highly escalated situation. Her ankle buckled under his weight. She fell and fractured her knee. The patient was charged with battery. The nurse had surgery, then quit. The young nurse suffered bruises and cuts to her arm. She was placed on paid administrative leave, then pressured to resign. The patient who attacked her remains at Glencroft. He was charged with a misdemeanor and given probation. The nurse suffered cuts above her left eye. The patient was charged with aggravated battery. The nurse had stitches, then returned to work. What was Amanda working on? Who was she talking to before her death? The nurse required skin grafting for second-degree burns. The patient was charged with assault. The nurse had a doctor's visit, then returned to work. The nurse bruised several ribs. The patient was charged with battery. The nurse had surgery, then returned to work. She was hired as an RN at Glencroft in March 2022. On her first day on the job, she was assigned to Ward 6. That same day, she reported concerns about a patient. Their goal is to force hospitals to acknowledge the problem of workplace violence in mental health facilities. Since going public, they've won some big victories. First, they lobbied for the installation of panic buttons in every patient room. Second, they demanded surveillance cameras in every common area. Third, they requested body cams for every officer that works security at the hospital. And finally, they wanted a promise from the administration to never retaliate against a whistleblower. Hospital officials agreed to all of those demands. 2 weeks later, she reported concerns about another patient. Is Ward 6 real?